1. The discovery of X-rays A. Background, scientific context. In the late 19th century, scientists were experimenting with electricity and cathode rays, streams of electrons produced in vacuum tubes. These experiments led to numerous discoveries in physics, including the eventual development of the X-ray machine. B. Discovery by Wilhelm Conrad Röntgen, 1895. The discovery of X-rays is credited to Wilhelm Conrad Röntgen, a German physicist, in November 1895. Röntgen was experimenting with a Crookes tube, a type of cathode ray tube, when he noticed that a nearby fluorescent screen began to glow, even though it was shielded by a thick piece of cardboard. He realized that some kind of unknown ray was penetrating the barrier. Since he did not know the nature of the rays, he called them X-rays, the X representing the unknown. C. First X-ray image. On December 22, 1895, Röntgen produced the first X-ray photograph, an image of his wife Anna Bertha Röntgen's hand, clearly showing her bones and her wedding ring. This image caused immense public and scientific interest. D. Recognition and impact. Röntgen published his findings in a paper titled On a New Kind of Rays, über eine neue Art von Strahlen, in 1896. He was awarded the first Nobel Prize in Physics in 1901 for this discovery. 2. Development of the X-ray machine. After Röntgen's discovery, scientists and doctors rapidly began to develop devices capable of generating and detecting X-rays. 1896, the first medical X-ray was taken in the U.S. by Dr. Edwin Frost at Dartmouth College. 1900s X-rays were used for bone fractures, locating bullets and identifying diseases like tuberculosis. 1913, William D. Coolidge developed the Coolidge tube, a more stable and controllable X-ray tube, which became the foundation for modern X-ray machines. 20th century onward, X-ray technology evolved to include fluoroscopy, computed tomography, CT scans, and digital radiography, enhancing medical diagnostics dramatically. 3. Medical contributions of X-rays A. Diagnostic imaging, bone fractures. X-rays allow clear visualization of bone breaks and dislocations. Dental care. Dentists use X-rays to detect cavities, bone loss, and abscesses. Chest imaging detects lung diseases like pneumonia, tuberculosis, or cancer, and heart enlargement. Mammography helps detect breast cancer at an early stage. CT scans. Advanced form of X-ray imaging providing detailed cross-sectional images of the body. B. Surgical and therapeutic uses guidance in surgery. X-rays and fluoroscopy help doctors navigate during minimally invasive surgeries. Radiation therapy. Modified high-energy X-rays are used to destroy cancer cells. C. Forensic and security applications. Forensic experts use X-rays to examine injuries, identify remains, and detect foreign objects. Security scanners use X-rays to inspect luggage and cargo. 4. Advantages of X-ray technology. 1. Non-invasive diagnosis allows internal imaging without surgery. Quick and painless. Procedures take only minutes and usually require no special preparation. 3. High accuracy. Excellent for detecting fractures, infections, and abnormal growths. 4. Cost-effective. Cheaper than many other imaging technologies like MRI or PET scans. CT. Wide availability. Found in hospitals, clinics, and even portable units for emergency care. Guidance for procedures. Assists in accurate placement of medical devices, catheters, stents, etc. 5. Disadvantages and risks of X-rays. 1. Radiation exposure. Repeated or excessive exposure can damage cells and increase cancer risk. 2. Not ideal for soft tissues. Limited clarity in imaging soft tissues compared to MRI or ultrasound. 3. Pregnancy risk. Can potentially harm developing fetuses. Pregnant women are generally advised to avoid X-rays unless absolutely necessary. 4. Allergic reactions in contrast studies. Some patients react to contrast agents used in enhanced X-ray imaging. 5. Equipment cost and maintenance. Advanced machines, like CT scanners, are expensive and require regular calibration. 6. Conclusion. The discovery of the X-ray by Wilhelm Conrad Röntgen revolutionized medicine and the physical sciences. It marked the beginning of modern diagnostic imaging, enabling doctors to see inside the human body without surgery. Despite certain risks associated with radiation exposure, the benefits of X-ray technology far outweigh its disadvantages, making it one of the most important medical innovations in human history. Like, subscribe, and follow for more.